We have Juanita Ferreira with us again today. Last time she spoke about children enhancing memory, cognitive function with the help of ginkgo and ginseng and bacopa. Today we're here to talk about the prevention and preservation of memory. Welcome back.
Thank you so much, Daleen.
Please share some pearls of wisdom with us. How could we prevent becoming dementia patients or Alzheimer's patients?
Absolutely. Well, I think importantly is our brains and our minds are our most valuable asset. Without it, we can't actually function within society and our quality of life is severely impacted. So you want to look after what you have straight from the beginning, and clinical data and literature shows us that decline cognitively already begins in the third decade of life. And with that, we see that with each subsequent and passing decade, there's further deterioration. So again, we approach this holistically. We want to make sure that what we're taking in from a diet perspective, our water, what we're inhaling from a pollutant perspective as well, needs to obviously be monitored and looked at. And we want to avoid all the bad things. So again, sugar can obviously have quite a poor impact. And also all the hidden nasties, which are from your preservatives, your sweeteners, all those kind of things. Very importantly is sleep. Something we take so for granted, but sleep really has an important function of not only allowing us to feel well the next day and through processing memories of the day and emotions even, but very importantly to eliminate certain proteins that over a lifetime, if they're not adequately eliminated, can actually contribute to the formation of different plaques and tangles that we identify in dementia patients.
Wow, so let's look at a mother in her 30s. She has all the problems. She's got lack of energy. She has lack of sleep. You know, you're thinking she's possibly physically very active. So she's tired and she's got young children. But you don't want to be worried about one day I may or may not have dementia or Alzheimer's. So you're saying now is the time to focus. But I know from experience as a mom that, you know, you have foggy memory and you have cognitive decline. And you're thinking it's just stress or it's just because I haven't slept, I've been up all night with my baby. How do I differentiate and when will the alarm bells go off? What do I look out for to just see, am I having a memory problem temporary or is this something permanent?
Definitely. So the red flags that you want to be able to identify is more than the usual memory loss. Where did I place my keys? You know, did I remember to pack my child's lunch, whatever the case might be. It's really when it significantly impacts quality of life, driving, not knowing exactly where you are, feeling very disorientated, and where that can even impact your anxiety. So you become even further disorientated and just totally confused. Those would be the red flags, and really it's clinical presentation. It's symptoms that are reported, and often we find that those close to us also pick up on it and might be aware of what's going on.
I think it's very concerning because you can miss it.
Definitely.
You could think I've just not had a good enough night's sleep.
Yes.
You know, I'm still not convinced that I would pick up that I'm having early onset dementia or Alzheimer's because I'm so busy and I get lost easily. I could dismiss that.
Absolutely. I think if someone is a little bit concerned, we live in a wonderful age of technology where resources are so accessible to us. So usually your practitioner might conduct something like a mini mental examination. And furthermore, there's something even better called the mini cog assessment, which is really a 3-minute screen that you would want a practitioner to do for you. And that would really be able to identify, are there any cognitive deficiencies? And if the patient already has been diagnosed with something of cognitive decline, that they would be able to actually monitor if there was any progress or decline in that patient.
Do you know of anything that a young 30-year-old male or female can take that could slow down the development of cognitive disorder?
Well, as we previously discussed, is your bacopa manieri. And the reason I say this is bacopa is not only going to preserve what you have from the perspective of memories and being able to facilitate information processing and learning, but it also has a neuroprotective effect from the point of having antioxidant effects anti-inflammatory effects. So really, if we think about chronic stress, like the mom that you were describing now, from the minute she gets up, looking after her husband or the household, and then going off to her own job, sitting in traffic, stress, all those kind of things, we know that chronic stress leads to chronic inflammation. And as soon as it's chronic, it's poor for us, it's not good. And the brain is exposed to that as much. I always like to think of the apple. When you take a bite of that apple and oxidation starts happening.
Turns brown.
It turns brown, it's rusting. And that is exactly what happens to our brains as well, with the exposure to all our free radicals and pollutants and stress and all those kind of things. So with something like the Bacopa as well, with those neuroprotective effects, you would be able to preserve and protect the brain structurally as well.
Does it have an anti-inflammatory action?
It does have an anti-inflammatory action, and I mean, the literature again shows us that at the Bacopa having a specific amount of your bacosides, which is usually in the range of at least 55%, that it will be able to exhibit those anti-inflammatory effects. And again, very importantly, is this would be something chronic. You know, the damage we often cause doesn't just happen in a day or two, it's over a lifetime. So optimal results would be over chronic use.
And when would you bring in something like ginkgo biloba? Because I know traditionally it's been used for thousands of years for optimizing cognitive function.
Definitely. So even if we are really employing a very good diet and sleeping well, we still see that sometimes we aren't able to take up all the nutrients and oxygen that we need. So for the patient who still feels like that mental fogginess or that heaviness, it's almost just sitting there in the front of the mind, something like your ginkgo biloba will improve not only your peripheral circulation, but also the cerebral circulation, as well as the delivery of your oxygen and nutrients. And that would make a significant difference. And we usually see with something like your ginkgo, our patients almost respond a little bit quicker, and that's because of that pickup.
So speed of thought.
Yes.
Okay.
Within the day of using it. And very nicely with your ginkgo biloba is that they've conducted clinical studies where they use a score called your quality of memory index. And that little score, all it does is it measures your ability to take up information, hold it, and then retrieve it, which is what we always want to be able to do on a daily basis.
Sure.
And what they found is that 1 hour after administrating your ginkgo, that there was significant improvement compared to placebo. And even
there's hope.
There's hope. There's hope. And even after stopping it, after chronic use, there was continued effect. So that shows a maintenance effect. And again, it's because of the improvement in your cerebral circulation, which is phenomenal.
So can you use both together?
Absolutely.
The ginkgo and the bacopa?
Definitely, you can use both together. There's no contraindication between them.
Do you know of a product that has them both in?
Unfortunately not. We're not there yet.
Right. It would be nice though.
Absolutely.
But I think if you look at standardization and quality of ingredient and manufacturing process, you probably want the best bacopa you can find and then the best ginkgo biloba product that you can find.
Absolutely. I mean, from identifying the correct plant, we need to then obviously remove the specific compounds and extracts that would be able to give us these functions. And often you're not able to do that just individually and combine it all together. Correct. They have different effects, synergistic effects or opposing effects. So yes, GMP as well as your good agricultural practice is so important as well, to make sure that what we're identifying as the active compound is that.
Right.
Yes.
Right. And do you have any knowledge regarding the interaction between bacopa or ginkgo and conventional medicine, a drug-herb interaction profile?
Well, for example, if we look at bacopa, bacopa has been identified as early as 1500 BC, but really at documented clinical literature, contraindications or drug interactions are not a concern with bacopa. It really is a very safe herb when manufactured and standardized correctly. The only concern with your ginkgo, which is documented, is that there can be an interaction with anticoagulants or blood thinners.
Right, so like your warfarins.
Like your warfarins. Right. And the reason for this is that your ginkgo is able to inhibit your blood activating factor. So it's able to reduce viscosity of the blood. So we just don't want to overdo that in a patient. So that's one of the cautions.
Would you recommend that a patient stops taking it before an operation?
Absolutely. With all herbs, we always advise that at least 10 to 14 days you should stop the herbal medication that you have. Although it's herb, plant, natural extract,
Sure.
these are products that can have a medically therapeutic effect. So surgery is critical, it's important. So yes, all herbs need to be stopped.
And then you can take it soon after. How soon after your operation?
Well, it usually will be under the advice of your surgeon or your supervising practitioner. We always advise responsible management of the patients. But again, usually it would be once they're recovering and up again, you can resume with your herbs.
And talking about later stages, 40s, 50s, 60s, ideally what you would like to do, well, if you're in your 30s and you're watching this, you want to immediately go and get Bacopa and ginkgo. But surely you can't stay on it for life.
I mean, I think with everything, you don't want to be on something permanently. You want your body to actually work and earn it. So yes, you can take intermittent breaks. We usually advise about 12 weeks at a time because most of your literature is based on 12-week treatment periods. And then
so on 12-week, off 12-week would be a good recipe?
On 12 weeks or 4 weeks. So you could maybe take, for example, a 4-week break. And again, the reason for this also would be looking at metabolism of Bacopa and the bacosides. So, or even with your ginkgo biloba, it's similar. So for example, it's almost a washout period and you could resume again. And when you look at, for example, also the impact that your Bacopa or your ginkgo, discussing it now today, the impact on your liver function, it really is negligible. So we also don't have to worry about that too much, which is wonderful because we don't want it to be a concern either.
Sure. Anything else that you'd like to share as far as declining memory and aging is concerned?
I think that importantly, again, the brain and the mind is our most important asset, and it's really about preserving and optimizing this, especially in our day and age. And as we move through normal decline, like your age-associated memory impairment, we just have to be aware of moving into even greater stages of that cognitive decline.
So rest.
The recipe for everything: good diet, what we put in, good sleep, and then obviously supplementing where we're unable to find it in a dietary source.
So to end off, Juanita, is there any advice that you have for someone that has a hereditary component to cognitive decline?
Absolutely. We would want to obviously be aware of this because we know that these conditions can have a genetic component and be passed down, but also to preserve what you have and to stay mentally stimulated. You know, it's the good old saying, use it or lose it. So you want to be able to stay cognitively stimulated all the time. And every time we learn something, even if it's something basic like cooking a recipe, that's a transfer of information between our nerve cells, and that change is what is growth. So you want to always be encouraging that, gardening, playing your Sudokus, reading, whatever the case is, staying stimulated.
Music as well.
Music, absolutely. And that's the thing about learning and memory. We always just think it's about the hard facts, learning black on white, but we learn through all our other senses, hearing, what we see, what we feel and experience. So it's about staying in tune with that as well. And as we previously mentioned, the good diet, good sleep, and making the most of all the resources at hand.
I think for me personally, what was most valuable about this is your advice: don't wait till it's too late.
Definitely.
You know, that you can actually do a lot as you go through your aging process, starting in your 30s.
Yes, absolutely. No, you want to be able to make a difference as early as possible, and as soon as we identify if there's something going on, you can already make a difference and you can make a change.
Great. That's great news. Thank you so much. It was so nice having you.
It's such a pleasure. Thank you, Daleen.